Now, in an adult, approximately 150 ml of CSF is present. Among them, 30 ml is in the ventricular system. Rest is present in the subarachnoid space. Yesterday, you have studied the meninges. I hope you know what is subarachnoid space. Now, when the CSF is continuously circulating, okay, after production, see, I have mentioned the point circulation. So once it is produced inside the ventricles, then it will circulate, okay, and it reaches up to the spinal cord also. Now, if you remember, we have studied the TS of the spinal cord in histo. In TS of the spinal cord, I have shown you the central canal. If you remember the diagram, what passes through the central canal? Central canal से क्या pass होता है? CSF is passing. So production is not taking place in the central canal of the spinal cord. Production is taking place in the ventricles of the brain. From there, it is coming into the central canal of the spinal cord. That means it is circulating. So whenever the CSF is circulating, at that time various exchange of the metabolites are taking place. As a result, the composition of the CSF changes, okay, because that is also a important function of the CSF. Next, if you see the composition of the CSF, so what do you think, what will be present in the CSF? Okay, so it is a clear colorless fluid, slightly alkaline in nature. Okay, clear colorless, slightly alkaline in nature, and if you see the specific gravity 1005 to 1008. Okay, next it contains some inorganic salts, okay, and traces of protein glucose similar to that of the blood plasma, but the amount of protein, okay, and glucose is less as compared to the blood plasma in the CSF. Okay, for your comparison, you can see what are the substances present in the CSF. So mostly it is made up of water, and some solids are there, 0.87%. Now in the solids, both we are having organic substances and inorganic substances. Okay, so here you can see the list of the organic substances, and here you can see the list of the inorganic substances present in the CSF. Okay, this thing I know you have studied in physiology, the composition of the CSF. Next, the most important part is the production of the CSF. So how the CSF is produced? Any idea? Okay, before going to the production of the CSF, let me tell you one thing. Approximately 500 to 600 ml of CSF is produced per day. Approximately 500 to 600 ml of CSF produced hota hai daily. But if you see the total volume of CSF in an adult, it is approximately 150 ml. तो बाकी कहाँ जाता है? हाँ? No. So continuously production is going on and absorption is going on. Okay, by the arachnoid villi and arachnoid granulations. Okay, so like this, the balance is maintained. Okay, if the absorption is not taking place properly, then what will happen? More amount of CSF will be accumulated inside the subarachnoid space. As a result, intracranial pressure will increase, and patient will have different types of complexities. Okay. So for that, continuous production is there and continuous absorption is also there. So 80 to 90% of the CSF is produced by the choroid plexus of lateral ventricle. Inside the brain, as I said, ventricles are there. Among them, the largest one is the lateral ventricle. दो lateral ventricle रहता है in both the cerebral hemisphere. Two cerebral hemispheres are there, right? Right and left cerebral hemisphere. Both the cerebral hemisphere, two lateral ventricles are there. Okay, and inside that, the choroidal plexuses are present, and 80 to 90% of the CSF are produced from those choroid plexus which are present inside the lateral ventricles. Okay, and the remaining they are produced from the choroid plexus of third ventricle and fourth ventricle. Okay, have you seen the ventricles? Means in the diagram, not because dissection is not done yet for the brain. Have you seen the diagram of the ventricles? Let me show you the diagram. Here you can see the diagram of the ventricles and the choroidal plexus. Okay, so see, this is the lateral ventricle, this is the lateral ventricle, this is the third ventricle, this is the acute act of Sylvius, after that this is the fourth ventricle. Okay, so these are the ventricles of the brain, and inside the ventricles you can see these are the choroidal plexus, this is the choroidal plexus, these are the choroidal plexus. from which the production of the CSF is taking place. Okay, ventricles will be taken separately. For ventricles, separate class will be taken where you have to know about the boundaries of each and every ventricle, how the boundaries are formed, and what are the relations of the boundaries. Okay, and then the communications of the ventricles. Now, you have to understand one thing, the production of the CSF which is taking place, that is not an ultrafiltration. Okay, ultrafiltration or dialysis nahi hota hai in the production of CSF, rather it is secretion. Okay, rather it is a secretion. As you can see, the process of the production is secretion or filtration. Okay, and the process of secretion that involves active transport mechanism. So an active transport mechanism is there which helps in the production of CSF. ठीक है, तो उसमें क्या होता है, mainly the choroidal epithelium by active sodium pump. Okay, so an active sodium pump is there. In the cost of energy, the ion transport is taking place. Okay, that means some ion from blood will go to the CSF and some ion from the CSF will go back to the blood. Like this, the ion transport is taking place, and the ion transport which is taking place, that is active, not passive. That means it needs energy to transport those ions. Okay, so as you can see, the net transfer of the positive charge by the movement of sodium ion into the CSF, which is associated by chlorine and HCO3. So along with the sodium ion, chlorine and HCO3 ion is also passing. That means they will come to the CSF from the blood. Along with that, what happens? The reciprocal movement of hydrogen and potassium takes place out of the CSF. From CSF, they will go back to the blood. So like this, the ion transport is taking place. Okay, and that is called as active transport mechanism. And this active transport mechanism, here you can see the diagram. Okay, so this side is CSF, this side is blood, and these are the cells of the choroidal plexus. Okay, I will show you the structure of choroidal plexus. Okay, now this is the cells of the choroidal plexus. Okay, and this side is CSF and this side is blood. So here you can see active ion transport is taking place. Okay, which helps in the production of CSF. So along with the ion which is transferred, okay, what happens? The blood is also passed. Now, how the blood is water is passing. So the movement of the water into the CSF takes place passively to maintain the osmotic pressure. Okay, so water will go into the CSF to maintain the osmotic pressure, because when the production is taking place in that particular part, the pressure gradient is created. That means in that part the pressure is less. Okay, so the movement of the water will take place to maintain the osmotic pressure. Okay, now that's why the choroidal epithelium is acting bidirectionally. That means the ions are also passing. Some ions are going into the CSF, some ions are going out of the CSF, and along with that, water movement, molecules of the water movement is also taking place to maintain the osmotic equilibrium. Okay, so this is the mechanism for the production of CSF. Okay, next there are some substances which are helping, or you can say which can change the rate of production of CSF, and this is very important when you will be dealing with such cases. At that time, this particular points will help you a lot. Okay, for example, there are some substances, जैसे pilocarpine, ether extract from pituitary gland will stimulate the production of CSF. Okay, pilocarpine is a substance, is a drug. Okay, have you heard about this pilocarpine, anyone? जब ये माउथ ड्राइनेस होता है, okay, at that time this pilocarpine is given. Okay, there are some conditions where dryness is taking place in such a way that the speech becomes, whenever you are talking, it becomes very difficult. Okay, so to prevent that, this pilocarpine is given. Okay, so this pilocarpine, ether, then secretions from the pituitary gland, they can stimulate the CSF production. Okay, next, two different types of solutions are there. which can alter the CSF production. That is hypotonic solution and hypertonic solution. This I hope you have heard what is hypotonic solution and what is hypertonic solution. Okay. Now this line is very important. Now if you inject hypotonic saline, that will cause rise in the capillary pressure and intracranial pressure and fall in the osmotic pressure, leading increase in the CSF formation. So if you are giving hypotonic saline to a person, okay, at that time what will happen? CSF production will increase. Okay, CSF production will increase. At that time what will happen? There will be increase in the intracranial pressure. Next, in order to deal with the intracranial pressure, what you have to do? You can just give hypertonic saline, which decreases the CSF formation and decreases the CSF pressure, okay, or intracranial pressure. Okay, so there are different cases which you will be observing where the intracranial pressures are increased. Okay, at that time, how to decrease the intracranial pressure? The best way is to give the hypertonic saline. Okay, now what is there in the hypertonic saline? The injection 30 to 35% of sodium chloride or 50% of sucrose, okay, which will make the hypertonic saline. Now if that is given, then the production of CSF will be less and the intracranial pressure will also become less. Okay, so this is a way to deal with the increase in intracranial pressure. Okay. Next, the structure of choroidal plexus. Okay, the structure of choroidal plexus. Now, why the choroidal plexus is important? Why choroidal plexus is important? Just now I have mentioned that जो CSF का production होता है, that production of the CSF is taking place from the choroidal plexus, which is a specialized structure which is present inside the ventricles. Okay. जो ventricles होता है, inside that specialized structure is present. Let me show you the diagram. Okay, here you can see the structure of choroidal plexus. Okay, so actually what happens? First of all, have you heard about tila choroidea? Anyone? Have you heard about tila choroidea? No. Okay, so the choroidal plexus is present inside the tila choroidea. So actually tila choroidea होता क्या है? What is this tila choroidea? So the tuft of capillaries which are enclosed by a vascular layer of pia mater, okay, and which is lined by ependymal cells, that is called as tila choroidea. So tuft of capillaries will be there, and those tuft of capillaries will be covered by pia mater, vascular layer of the pia mater, and it will be lined by ependymal cell, that is the tila choroidea. And inside the tila choroidea you are getting the choroidal plexus. Okay, and this is the structure of choroidal plexus. Now in case of choroidal plexus, if you see the stroma or if you see the body of the choroidal plexus, it consists of many capillaries. Blood capillaries are there, separated from the subarachnoid space by the pia mater and arachnoid ependymal cells. Okay, so here you can see these are the arachnoid ependymal cells. This is the basement membrane for the arachnoid ependymal cells, and this is the blood capillary. Okay, तो जो CSF का production होता है, so this production is taking place through these cells. Okay, like this the production is taking place, and if you see the cells, they are connected to each other by tight junctions. Okay, next on the surface of the cells, cilia and microvilli both are present. So the function of the cilia is to help in the movement of the CSF after production. Okay, and once the production is done, this microvilli again they help in the absorption of the CSF. Okay, as you can see the microvilli are present. So that is the choroidal plexus. Next, in this particular zone, okay, a important structure is formed, that is called as blood CSF barrier. Okay, that is called as blood CSF barrier. Now in this particular zone, okay, I am talking about this particular part, the blood CSF barrier is formed. Okay, so we will be discussing about the blood CSF barrier, okay, which is very important, because the blood CSF barrier, here I have not mentioned the blood CSF barrier, I forgot to mention. Here you have to add one particular point. Okay, blood CSF barrier. So different types of barriers we have studied. Now yesterday while taking one class, I have asked you one question. Whenever you heard about this barrier, okay, any barrier, any type of barrier, what comes into your mind? Layers will be present. कोई भी barrier हो उसमें different layers रहता है, ठीक है? And the best way to understand the barrier is either you write the layers from inside to outside or outside to inside. Okay, here also you can see the barrier which is formed. See, this is the barrier, so these are the layers present in the barrier. Okay, and in most of the cases barriers are highly selective. Okay, that's why barrier is given. It is highly selective, or you can say it is just acting as a filter. The substances which are required, that only can pass the barrier, which are not required, not be able to pass the barrier. That is the requirement of the barrier. Now in this case, why it is important? Any idea why the blood CSF barrier is important? First of all, it will maintain the homeostasis of the brain and it prevents the neurotoxicity. Suppose you have taken something, you are taking some pills, you are taking some drugs or some other materials which may be harmful for the nervous system. Okay, unless and until it is crossing this, it can't reach the nervous system. Okay, so the neurotoxicity is prevented and the homeostasis of the brain is also maintained. That's why blood CSF barrier is very important. Okay. Next, this you can see the location of the choroidal plexus. Okay, so just now we have seen the structure of the choroidal plexus. Okay, how the choroidal plexus is present, what are the cells present. So which cells are present? Ependymal cells. Okay, these are the simple cuboidal epithelium having microvilli. Okay, and ciliated. Next, you can see the locations. So now I am not going into the ventricles. As I said, for the ventricles, separate class will be taken in which we will discuss about each and every ventricle, their boundaries, relations, and the choroidal plexus. Okay. Now, in the beginning of the choroidal plexus, I have mentioned about one structure, that is tila choroidea. Okay. Now this tila choroidea, the formation and the shape of the tila choroidea for each and every ventricle is not same, it is different. Okay, that also you have to study. And next important point, inside the tila choroidea only the choroidal plexuses are present. Okay, so what we are doing now, we are taking the section of brain. Okay, we are preparing the specimen for you. Okay, so first of all we have to take out the skull cap, we have to remove the dura, and then we have to take out the brain. When we will be taking out the brain, we have to cut the lowest part of the brain stem, just above the spinal cord, so that it can be taken out easily. Once it is taken out, then we will be taking sagittal section and coronal section, because two bodies are there. Okay, where you will be shown the ventricles, and along with that inside the ventricles जो choroidal plexus रहता है, those things will also be shown. Okay. So after production, what will happen? After production, मान लो CSF produce हो गया. Once it is produced, then what will happen? Circulation. Blood produce होता है. After that क्या होता है blood का? Circulate होता है from one part, because these are fluid. Same. Once the CSF is produced, the circulation of the CSF will take place. Okay. Now it is having a particular direction, and through that direction only, or through that pathway only, the CSF will circulate. Okay, because ultimately where the CSF will reach, when the terminal part, means when the circulation is done, okay, at that time where it will reach into the venous system. Okay, that is the absorption. So first we have seen the production, mechanism of production. Now we are in circulation, and after circulation, absorption. Okay, this is the cycle of the CSF flow. So now we are in circulation. So this is the chart. With the help of this chart, you can understand easily the circulation of the CSF. Okay. So first of all, you can see, so most of the CSF, where it is formed? Choroid plexus of which ventricle? Lateral ventricle. Choroid plexus हर ventricle में रहता है. but 80 to 90% of the CSF are produced by the coronal plexus of lateral ventricle. Remaining 10 to 20% they are formed from the third and fourth ventricle. Okay. So first of all, you can see the lateral ventricle. From the lateral ventricle, interventricular foramen, through intraventricular foramen it will go to the third ventricle. From third ventricle, with the help of aqueduct of Sylvius, it will go to the fourth ventricle. Now once it reaches the fourth ventricle, then two pathways are there. It will go to the central canal of the spinal cord, as we have studied. Next, over here it will go to the cisterns. Okay. Now on the fourth ventricle, two openings are there. Okay. So one opening is present at the center and two openings are present at the lateral portion. Okay. So those openings, through those openings the CSF comes out from the fourth ventricle. Once it comes out from the fourth ventricle, it will go to the subarachnoid spaces, and specially they are called as cisterns. Cisterns. Have you heard about it? Cisterns. What are those cisterns? Cisterns क्या होता है? CISTERNS. Cisterns. Okay. For your reference, you can see this is one cistern. Okay. To say production is taking place over here. Okay. From here the production, once it is taking place, then you can see it is coming to the third ventricle. This is the third ventricle. From the third ventricle, this is the aqueduct of Sylvius, then it will come to the fourth ventricle. Once it is coming to the fourth ventricle, then there are two directions. Okay, one direction is it will come down into the spinal cord through central canal, and another direction is there where on the roof three openings are there, one at the center and two on the lateral aspect. From there the CSF goes into the cisterns. So these are the cisterns, as you can see. Okay. Now the question is, what are those cisterns? See, तो क्या होता है जो subarachnoid space है? So there are some areas of the central nervous system where the subarachnoid space is dilated. Okay, that means the space between the subarachnoid matter and pia matter, okay, it is large, and those areas are called as cisterns. Okay, so different cisterns are there in our central nervous system. Among them, the largest one is the cisterna magna. This is the largest cistern, cisterna magna. Okay, where those CSF are also going. Okay, so next you can see cerebellomedullary cistern. Okay, cerebellomedullary cistern and pontine cistern. This is the largest cistern of the body. Then you can see it, through tentorial notch, it is going to the inferior surface of the cerebrum. Okay, see inferior surface of the cerebrum. Then superolateral surface of the cerebrum. This is the superolateral surface of the cerebrum. Then it is reaching the arachnoid granulations. You can see these are the arachnoid granulations. Okay. Now in the arachnoid granulations, when it will reach, the absorption of the CSF will take place. Okay, and ultimately they will go to the dural venous sinuses. Okay, mainly superior sagittal sinus. So this is the circulation of CSF. Okay, so you have to follow the circulation of CSF from the beginning. That means from the lateral ventricle. From lateral ventricle, it is coming to the third ventricle. From third ventricle to aqueduct of Sylvius, it will reach the fourth ventricle. Once it is reaching the fourth ventricle, then two directions are there, or two pathways are there. First pathway, it will go to the spinal cord via central canal. Second pathway, through the opening of the roof, it will go to the different cisterns. Okay, and from those cisterns, as you can see, this is the direction. Okay, so here you can see this diagram is very helpful to make you understand about the direction of the CSF. Okay, now once it is reaching the arachnoid granulations, okay, once it is reaching the arachnoid granulation, okay, where in the superolateral surface of the brain, at that time the absorption of the CSF starts. Okay, now these arachnoid granulations are related with different dural venous sinuses. You have studied the durameter, right? So have you studied the dural venous sinuses? Yes, so you know what are those dural venous sinuses. So those arachnoid granulations are related to those dural venous sinuses, okay, from where the absorption of the CSF is taking place. Okay. Now see, this is a diagram where you can see the direction of the flow. Okay, so this is the direction of the flow of CSF. So with the help of the arrow, you can see the direction of the flow of CSF into the ventricular system, and ultimately it is reaching the central canal, and along with that it is also reaching the cisterns. Okay, next is the absorption. So absorption is very important. Why the CSF absorption is important? Why the CSF absorption is important? Any idea why the CSF absorption is important? To maintain the intracranial pressure. Okay, अगर absorption नहीं होता, continuously secretion होगा, what will happen? The pressure will increase. Okay, to maintain the pressure, the CSF absorption is very important. Okay, so most of the CSF drain into the venous blood, especially into the superior sagittal sinus. If you have studied the dural venous sinuses, I hope you have seen or you have studied the superior sagittal sinus, inferior sagittal sinus. If not, please study the dural venous sinuses, very important. Okay, because at the end of the neuroanatomy we will be discussing about blood supply of brain. Okay, where arterial supply and venous drainage is there. So जो venous drainage होता है, that is completely based on the dural venous sinuses. Okay. So mostly the fluid CSF, where it will go into the venous system, especially into the dural venous sinuses. That also superior sagittal sinus, where arachnoid granulations and villi are present. Now, though you have studied the CSF in physiology, can anyone tell me what is the main difference between the arachnoid granulation and villi? Anyone? You can't say arachnoid granulation or villi. It is arachnoid granulation and villi. दोनों में difference क्या है? Any idea what will be the difference? Difference between the arachnoid granulation and villi, in case of an infant, okay, up to 18 months, okay, the arachnoid villi are present. Okay, the structure is almost microscopic in nature. After 3 years of age, the arachnoid villi it converted into arachnoid granulation. Okay, so after 3 years of age, you will be getting the arachnoid granulations. Okay, beyond that, before that, it is arachnoid villi, microscopic structure. Now, once the villi changes into granulation, the structure also changes, and structure becomes very complicated. So here I have not selected the structure, means I have not added the structure because it is very difficult. Just you know that the arachnoid granulations are there and from where the absorption is taking place. Okay, the difference, I hope it is clear. Villi in case of infant, and from infant up to 18 months. Okay, villi is there. Once 3 years is crossed, at that time the villi it changes into granulations. Okay. Now at old ages what happens, sometimes ये जो granulations होता है, they used to get calcified. जो granulations होता है, they used to get calcified. So as a result, what will happen? Absorption will not take place. Okay. Now what are these arachnoid granulations? So these are focal outpushings of the arachnoid matter and subarachnoid space through the wall of dural venous sinuses. Okay, let me show you the diagram. So here you can see. So this is the superior sagittal sinus. Now here you can see the outpushing of the subarachnoid space and the arachnoid matter, okay, into the dural venous sinus. So this is arachnoid granulation. We are not discussing about the villi, we are discussing about the arachnoid granulation. Okay. So this is a easy diagram, drawable diagram, okay, which you can draw one if it comes in the exam. So these are the focal outpushing of arachnoid matter and subarachnoid space through the dural venous sinus. Okay, you can see this is the wall of the dural venous sinus. Through the dural venous sinus, they are pushing and they are going inside the dural venous sinus, near the termination of the vein. Okay, okay, where the veins enter the dural venous sinuses, just near the veins where it enters the dural venous sinus. As you can see, the vein where it enters the dural venous sinus, adjacent to that, the out pushings are there, and those are the okay. So this particular arachnoid granulations, okay, what is present? It is permeated by network of minute channels. Okay, it is permeated by minute channels. So as you can see in the diagram, the minute channels are there. See, these are the minute channels, and it is lined by mesothelial cells. Minute channels are there, and it is lined by mesothelial cells. Now the speciality of the arachnoid granulations are, okay, what it will do, it will control the flow of the fluid in one direction only. That means from arachnoid granulation, okay, the fluid will go into the venous system. The backflow is not taking place, and that is due to the pressure gradient. Okay, have you understood what happened? So from here the fluid will go into the venous system. See, it is going into the venous system, but it is not coming back into the granulation. Okay, so that is the function, one of the important function of the arachnoid granulation. Okay. Now this unidirectional flow is regulated by pressure of the CSF. Okay. Now here you can see what happens. The formation, circulation and absorption of CSF follows a pressure gradient. That is high pressure capillary bed of the choroid plexus from which the formation is taking place. Okay. Always keep that in mind. The capillary plexus where the blood is flowing, that is having high pressure gradient. Okay. Because from there only the production is taking place. Okay, to the low pressure filled ventricles. Okay, after that the ventricular system where there the pressure is low. And next, if you see the subarachnoid space, the lowest pressure is the venous blood in the dural sinuses. Okay, so each and every cases the pressure gradient is taking place. So first highest pressure is in the capillary plexus of the choroidal plexus. After that, the next pressure gradient is inside the ventricle, where the pressure is less, and the lowest is in the subarachnoid space. Lowest is in the dural venous sinus. Here, lowest in the dural venous sinus. So because of this pressure gradient, the CSF is flowing unidirectionally. That means from the arachnoid granulation, it is coming out and then it is draining into the dural venous sinus. Backflow is prevented by this pressure gradient. Okay, so this is the absorption. Next is the pressure of the CSF. So as I have mentioned, the pressure of the CSF changes when the body posture changes. Okay, so here you can see in lateral recumbent position it is 10 to 18 cm of water. Lying position 13, sitting position 30 cm of water. Okay, so these are the various changes in the pressure when the position of the body changes. Okay, next, compression of the internal jugular vein also raises the CSF pressure. Okay, that means if you compress the internal jugular vein, the CSF pressure also increases. Okay. Lastly, the functions of the CSF. So we have studied about the composition of the CSF, what exactly the CSF is, then the production of the CSF, then absorption of the CSF. Okay. Next, the pressure of the CSF. Now, what do you think? What will be the functions of the CSF? CSF का function क्या होगा? What will be the function of the CSF? See, first of all, it acts as a cushion between the central nervous system and surrounding bones. Okay. Next, it acts as a shock absorber for central nervous system. Then it supports the brain and spinal cord. Okay. Maintains the uniform pressure upon them. Okay. Supports the brain and spinal cord and maintains the uniform pressure on them. And as I said, the brain is simply floating on the CSF. As a result, the weight of the brain is not felt. Okay. Next, if you see, it nourishes the central nervous system, removes the metabolites, okay, and serves as a pathway for pineal secretion to reach the pituitary gland. Okay. Other functions are also there, but these are some important functions of the CSF. Okay. If you want, you can add some other functions also. Okay. Next, is the blood CSF barrier. So already I have mentioned about the blood CSF barrier. Now here you can see this is the diagram showing the blood CSF barrier. Okay. So this side blood is present and this side CSF is present. In between this the barrier is formed. Okay. So the how the barrier will be formed? That means some layers will be there. Okay. So see these are the layers. So first you will be getting the endothelium. Okay. As you can see the choroidal endothelium are there which are lying in a basement membrane, and in between the choroidal endothelium, okay, in between the endothelium of the capillaries you can see fenestrations are there. Okay, you can see the fenestrations are there. Okay, and they are lying in the basement membrane. Next layer you will be getting the ependymal cells which are present inside the ventricles. So see these are the ependymal cells. Now ependymal cells are connected to each other with the help of tight junction. Okay. Now these ependymal cells they are also resting in a basement membrane. Okay, and then you are getting the microvilli of the ependymal cell. So in between this the barrier is formed. Okay, in between this the barrier is formed. Okay. Now the importance of the barrier you have to understand. If there is any infection in the CSF, even antibodies are not allowed to enter the CSF. Okay. So you can see antibodies are not found in the CSF, hence infection of the CSF are often fatal. So अगर कोई infectious substance are present in the CSF, okay, it is fatal. Why? Because no antibodies are allowed to enter the CSF. Why? Because they are not able to cross this barrier. Okay. Next, when a person is suffering from jaundice, okay, as you can see, bile is not found in CSF in severe jaundice. Okay, in case of severe jaundice, if you see the CSF, the bile will not be present over there. Why? Because of this particular barrier. It is not allowing to go inside the CSF. Next, if you see, most of the drugs cannot reach the CSF. Okay, because if they reach the CSF, what will happen? Neurotoxicity will be there. Homeostasis of the nervous tissue will not be maintained. That's why this particular barrier is given. Okay. Next, another diagram is there. Yeah. Here you can see this is a diagram forming the blood CSF barrier. Okay, same diagram, but I will request you to use the previous diagram, first diagram. Okay, where the structure is shown clearly. Okay, so that is all about the blood CSF barrier. Next is the applied part of the CSF. So there is a very famous test that is called as Quecken's test. Okay, इसमें क्या होता है? In 1916 a famous scientist H.G. Quecken's, okay, he was done a test. He have done a test in order to see the changes of the pressure, intracranial pressure. Now how it is done? So first of all, when the veins of the neck are compressed, I am talking about the internal jugular veins. Okay, if the veins of the neck are compressed, either in one side or both the side, at that time what will happen? There is a rapid rise in the pressure of CSF in healthy person. So if you compress the internal jugular vein in a healthy person, one side or both the side, at that time what will happen? There will be rise in the intracranial pressure. That means there will be increase in the production of CSF. That is normal. Okay, normal. In normal person it is there, but if there is any blockage, जो CSF का जो flow होता है, in that if any blockage or if any obstruction is there, at that time if you compress the internal jugular vein in the one side or either side of the neck, hardly any changes will be taking place. Okay, I am talking about intracranial pressure. So like this, if any obstruction is there or not, that can be identified with the help of this test. Okay, अगर मान लो obstruction नहीं है, ठीक है, then if you are compressing the veins of the neck, the intracranial pressure will increase. Okay, that is normal. Now if any blockage is there and if you are pressing the veins of the neck, at that time there will be no changes in the intracranial pressure. That suggests that some blockages are there. Okay, but those are old method. Nowadays these methods are not used. Instead of that, MRI is done. With the help of MRI, easily if any blockage is there, it can be diagnosed easily. Okay, you don't have to compress the internal jugular vein. So here you can see the Queckensted's test is done. So the veins of the neck are compressed either one side or both the side. As a result, what will happen? If it is normal, then there will be increase in the intracranial pressure, okay, which can be monitored by manometer. Next, the lumbar puncture. So why the lumbar puncture is done? In order to withdraw the CSF. Okay. So in order to withdraw the CSF for therapeutical purpose or different laboratory purpose, to do the laboratory investigation of the CSF, the lumbar puncture is done. Okay. Now don't think that only lumbar puncture is the solution to take out the CSF. There are some contraindication of the lumbar puncture. In that case, the cisternal puncture is also done. Okay, cisternal puncture is also done in order to take out the CSF. Okay. Next, Froehn syndrome is there. Now, what is this Froehn syndrome, or also called as loculation syndrome? इसमें क्या होता है? If the block occurs anywhere in the ventricular canal, okay, the flow of the CSF, if any obstruction is taking place, at that time what will happen? There will be some different properties. So it coagulates continuously and the amount of protein inside the CSF increases. Amount of protein, because obstruction is there, okay, it is not going out into the venous system, accumulation will take place, and as a result the composition of the CSF changes. So at that time amount of protein accumulates in the CSF and the color of the CSF will change. Okay. So you can see the color of the CSF may change, it may become yellow in color. Now sudden increase in the intracranial pressure is not transmitted to the CSF below the level of the block. Okay, so these are some changes taking place when blockage is there. Okay, mainly agar blockage hota hai, so what will happen? The color of the CSF will change because high increase in the protein content. Next is the hydrocephalus. Anyone have you heard about hydrocephalus? Hydrocephalus, I hope you have heard. Let me show you the diagram. See, this condition is called as hydrocephalus. In case of children, hydrocephalus is noticeable clearly. Okay, so it is an abnormal increase in the volume of CSF within the skull. Abnormal amount of CSF, if it is getting accumulated inside the skull, at that time the condition is called as CSF. Hydrocephalus. So at that time what will happen? It is characterized by excessive accumulation of CSF, okay, inside the ventricles or in the subarachnoid space. Okay. So इससे क्या होगा? There will be increase in the intracranial pressure. Along with that, headache will be there. Okay, vomiting will be there, and in serious condition, atrophy, mental weakness, convulsions. These are the different symptoms takes place. Okay. Because if the pressure increases, it will compress the brain tissue at that time, and if it is for longer period of time, atrophy may be there, convulsions may be there, severe headache, okay, weakness. These are the different symptoms of hydrocephalus. Now what do you think, what will be the causes of the hydrocephalus? First of all, if there is excessive production of CSF, then if there is obstruction in the circulation of the CSF, okay, then interference with the absorption of the CSF. Dekho, two things are there. First of all, once the CSF is produced, it is flowing. Okay. Now, when it is circulating, in that, if any blockage is there, okay, at that time also the amount of CSF will increase. Next, when the absorption is taking place, if that time the arachnoid granulations, agar usme calcification hota hai, then absorption will not take place. At that time also the amount of CSF will increase. So these are some different reasons where the amount of CSF increases. As a result, the intracranial pressure increases. Okay. Now there are two different types of hydrocephalus. Okay, that is non-communicating and communicating. Okay. In case of non-communicating, the CSF accumulates within the ventricular system. Okay, so lateral ventricle hai, third ventricle hai, fourth ventricle hai. Within that, if the obstruction is taking place, okay, then it is called as non-communicating hydrocephalus. Now why it occurs? It occurs due to blockage at the point between the site of formation and the choroid plexus and the site of exit. Okay, तो मान लो जहाँ पे प्रोडक्शन होगा एंड जहाँ से निकल रहा है, in between that if any obstruction is there, then it is called non-communicating hydrocephalus. In case of communicating hydrocephalus, no obstruction within or outflow of the ventricular system commonly occurs due to blockage of the arachnoid villi or granulation. That means in the absorption part, if there is any blockage or obstruction, mainly due to meningitis or adhesion, at that time this communicating one is taking place, communicating hydrocephalus. Okay, so two types of hydrocephalus are there. Now, if a hydrocephalus is taking place, then what are the clinical features? Can you see the diagram? This diagram. Now, if hydrocephalus is taking place, just see the different clinical features. First of all, there will be disproportionately large size of head. Can you see the size of head? It becomes larger, and especially these symptoms, clinical features can be seen in children. Okay, not in adult age. So disproportionately large size of head, then bulging of forehead, widely separated cranial sutures. Have you studied about the frontalis? You have not studied about frontalis? In fetal skull, frontalis are there. I hope you have studied. Okay, so there will be enlarged frontanelli, anterior frontanelli will get enlarged. Scalp will be dilated with scalp veins. Scalp veins will get dilated and it can be seen easily. Okay, then eyes look down, giving a setting sun appearance of the eye. Okay, then progressive loss and motor function, dementia, cranial nerve paralysis are common. So these are some important clinical features which are taking place in hydrocephalus. Okay, especially in case of infant and young children, these clinical features are seen. Okay, in case of hydrocephalus. So these are the cases, whatever we have discussed, this is for increased intracranial pressure due to either obstruction is there or absorption is not taking place. Now what will happen if there is less amount of CSF? What will happen if there is less amount of CSF? So in case of low CSF states, low volume of CSF are most commonly due to CSF leak. If there is leakage of CSF is taking place. Okay, how? Due to the damage of ependymal cells of the ventricle, or leakage may be take place. Suppose a lumbar puncture is done, and after doing lumbar puncture, huge amount of CSF is taken out. Okay, at that time also the amount of CSF will drop. Okay, then if there is cystic dilatation and if that ruptures. Okay, next if craniotomy is done or if there is any road traffic accident, at that time what will happen? The amount of CSF will get reduced. Okay, now in states of low CSF, patient may experience orthostatic headache. What is orthostatic headache? Orthostatic headache का मतलब है whenever you change the position you feel headache. It is the orthostatic headache. Okay, this is a important clinical feature when there is less amount of CSF. Now due to intracranial hypotension, and mostly it is self-limiting unless if any leakage is there. Okay, if leakage is there, then this has to be treated, or else it is self-limiting. Now in addition, the pathological state, the ependymal cells of the choroid plexus may undergo age-related atrophy, okay, which can reduce in the production of CSF. तो जो choroidal plexus का जो cells होता है, okay, age-related atrophy can take place. As a result, the production of the CSF will get reduced. Okay, so these are some condition takes place when there is low CSF in the subarachnoid space. Okay, so that is all about the CSF. Okay, so I have covered all the points. Okay, all these points are covered. So I'll request everyone to study and revise everything about the CSF. So first you have studied about the meninges, and now we have discussed about the CSF. So I'll request please correlate. Okay, and I have seen when I have mentioned the word cistern, most of the students got confused. Please study what are those cisterns. I know you have studied in the meninges. Okay, in the meninges chapter you have studied about the cisterns. Okay, thank you.